Hi, and thank you for joining me today. I'm Dr. Traci Patterson with Holistic Center Treatment, and today we're going to jump into part 2 of our video series on CRPS. So thanks for joining me, and to me, knowledge is power. So let's see where we can go with that. For those new to the diagnosis or perhaps a family member trying to gather additional information, maybe even a healthcare provider, that their patients are diagnosed with CRPS and they're trying to wrap their arms around it. This is a great stepping stone in our series where we're going to specifically talk about CRPS, what it is, and some of the traditional treatments that patients go through. So let's jump into that. So someone who's diagnosed with CRPS is living with daily challenges. They're having to cope with pain that doesn't always have that quick fix. It's not a strain, it's not a sprain, and it's not just post-surgical pain. So the diagnosis also comes with us hearing, I'm sorry, you're diagnosed with a rare incurable disease. And that leaves our head spinning, it leaves us frustrating, it leaves us feeling overwhelmed. And there's so many different challenges that we have to overcome. So we're looking to our physicians for those answers because they're supposed to hold those. But what happens when our physicians don't have the answers? When we're left to fend for ourselves, or when the treatments that we're going through aren't necessarily helping us. As a patient, we feel like we have to alter our dreams, our ambitions, because we're told this is your new life. We're told this is the best it's going to get. I even had one physician tell me, life as you knew it just ended. What do these statements mean when we're diagnosed with CRPS? For most, it leaves us in the state of fear and frustration, feeling overwhelmed, and worst of all, feeling hopeless and helpless. But we need to change that trajectory. We need to change the way we look at CRPS. So people living with CRPS are having to cope with others looking at them like, but you should be okay. People not understanding the invisible pain that we're enduring. We feel like we, again, have to defend it because people just see one small segment of time. Most of us are not in a cast. We're not in the hospital. We're at home isolating simply in survival mode. And that's not what we want. And this is why CRPS and so many other complex chronic pain conditions are also known as invisible pain. So when it comes to CRPS, one of the problems that we run into is the fact that there's not a specific diagnostic test for CRPS. So therefore, by the time we're referred over to rheumatology, a neurologist, or pain management, they're running other tests, diagnostic tests, to rule out other potential diagnosis. Now, when those tests come back normal or inconclusive, then at that point in time, they're going to look at what they call the Budapest criteria, and that is signs and symptoms. So when your pain management doctor looks at the Budapest criteria, they're looking at pain levels. Is it outside of what they would normally expect for someone with a particular injury, an incident, or post-surgically? They're looking at sensitivity to touch. They're looking at coloration changes, temperature changes, potential changes in hair or nail growth. So these are all things that they're looking at with the Budapest criteria. And then once you're diagnosed, I don't care what pain management doctor you're at, what university or what clinic, most physicians use a typical flow chart when treating CRPS. You're diagnosed. The next step is giving you a referral for physical therapy or occupational therapy, giving you a prescription for medication. Gabapentin is the go-to right now. Otherwise, it's Lyrica, for some people, Neurontin. Some physicians are prescribing NSAIDs or anti-inflammatories. Some physicians are using antidepressants. And there's also muscle relaxants if people are having muscle spasms, dystonia. And those are typical medications that your doctors are prescribing, and mine did the same thing. From there, they're going to talk about blocks. If it's lower extremity, a lumbar sympathetic block, If it's upper extremity, what they call a stellate ganglion block. Then for some people, if that's not working, they're referred over to a pain psychologist to talk about coping with your pain or giving you coping mechanisms. For some individuals from that point when things are not working, they're talking to you about spinal cord stimulators or DRG stimulators or what they call neurostimulators. For some people, when that's not working, then they go to nerve ablation, pain pumps. And the problem is the majority of CRPS patients simply aren't getting better with this particular flow chart because they're wanting to treat the symptoms. And CRPS goes beyond the symptoms of the pain. We're now dealing with centralized pain, and we're also dealing with your autonomic system. And this is just simply not an area that they're addressing with CRPS with the majority of patients. And that's why the majority of patients with traditional treatments, or what they call allopathic treatments, are simply not getting better because they're only treating your symptoms. So CRPS surpasses that initial injury, that surgery, the incident, and it persists. Therefore, you have to take a different approach to get a different outcome. To the outside world, a CRPS patient puts on this great facade and everybody says, oh, they're fine, they're okay. But the problem is on the inside, we're in a different reality. We're in pain, we feel lost, we're frustrated, we're angry at the world, we feel overwhelmed, we're sad, we feel hopeless, we feel unhappy, we're crying, and we feel let down. Not only by the medical community, but by the world around us, because how in the world are we having to go through this? And I understand that our system's broken. Every doctor has a specialty, and depending on your diagnosis, that's an amazing thing, and it works. But when we have CRPS or we have other complex diagnosis, and we're labeled as complex, the current system simply isn't working. And we have to change this paradigm because it's failing patients. It's failing CRPS patients. And I want you to know it's not just you. You're not the only one diagnosed with CRPS. You're not the only one struggling, and you're not alone. And I hope you'll tune in to our next video in the series where we start delving into other information on CRPS and other ways to be able to tackle this. Thank you again for joining me, and we look forward to putting out our next series in the videos on CRPS. Thank you.